Video presentation by Department of Panchakarma, Sindhi Shantavareshwara Ayurvedic Medical College and Hospital, Haveri. This topic is about Uttara Basti, an overview of Uttara Basti in Panchakarma. Introduction. The Basti administered through the Uttara Marga and has Shrestha Guna is known as Uttara Basti. Uttara Marga means the Mutra and Shukra Marga in male and Mutra and Yoni Marga in female. The Basti which is administered after Nirodha Basti through the Uttara Marga is said to be Uttara Basti. Uttara Basti Yantra. Like usual Basti Yantra, this Yantra also consists of two parts, Basti Putaka and Basti Netra. Basti Putaka. Since the quantity of Kvata or Sneha administered is comparatively less, small size animal bladder are also used for this purpose. For instance, bladder of goat, sheep, pig, etc. are used, or else even the leather of birds are also other smooth leather can be used. Basti Netra. It is also called Pushpa Netra. It should be 10 angula in length for administering Uttara Basti in women. It should be made from gold, silver or bronze. Its shape resembles the petal of a flower or gopucha, broad at the base, tapering towards the end. Its shape resembles the petal of a flower or gopucha. The opening at the anterior end of the netra should be a diameter of Sarshapa. Acharya Chakrapani commenting on opined that the netra should have two karnikas, one at the base for tying the putaka, other at the level of 6 angula from the tip. Types. It is of two types, Sneha as that of Sneha Basti, Shodhana like Nirodha Basti. Drugs used. Like Basti Karma, both the Kashaya as well as Sneha are used in Uttara Basti. Dose. There are some difference of opinion regarding on exact dose of medicines to be administered in Uttara Basti. It is also differs according to whether the Kashaya or Sneha is used. According to Acharya Charaka, dose of Sneha should be Ardhaphala. He has not clearly mentioned about the exact Uttara Basti to given with Kashaya. He told that the amount of Kashaya to be administered should be decided according to condition. According to Shushruta, Kvata 2 Prastra, Sneha 1 Prastra. Time of administration. Ideal time for Uttara Basti administration. General timing. Morning time after digestion of previous meal is considered as best. Empty bladder and bowels are required. Ideally done between 8 am to 10 am or when Agni is strong. Based on doshas. For Vata dosha, early morning or late afternoon. For Pitta dosha, midday 10 am to 2 pm. For Kapha dosha, early morning 6 am to 10 am. In women, post-menstrual phase is ideal. 4th day to 14th day of menstruation cycle, after cessation of menses and before ovulation. Uterus is relatively clean and receptive. Avoid during menstruation, pregnancy, ovulation period. Ideal time for administration in males. Time of day. Morning time is ideal after completion of digestion of previous meal, preferred between 8 am to 10 am. Patient must have passed urine and stools before the procedure. According to season, Vasanta and Sharad seasons are considered best. Avoid during extremely cold and rainy seasons unless strong indicated. Duration of procedure. Typically administered for 3, 5 or 7 days depending on the condition of individual constitution and nature of drug used. Uttara Basti Karma Vidhi. Pura Karma. As per the derivation of the word Uttara Basti should be given after the administration of Nirodha Basti. According to Acharya Vagbhata, about 2 to 3 Nirodha Basti should be given before the administration of Uttara Basti. Abhyanga and Shvedana Karma should be done preferably over back, groin, abdomen. Then Yavagu added with ghee should be given for drinking. Instruments: straight rubber catheter, often referred to as a Robinson catheter number 4, disposable syringe of 50 ml capacity, hemostatic forceps, sponge holding forceps, green wound clothes, conical flask and glass bottle for oil, gloves, surgical mask and cotton gauze pads, towel clips. All these instruments should be properly autoclaved and procedure should be conducted in OT room under strict aseptic measures. Panchakarma. In male, the patient should be brought to the Basti room and advised to lie on the table. The penis is made to erect. Then the Basti yantra containing the Kvata or Sneha is taken and Basti netra as well as the urethral meatus is lubricated with Sneha. Netra is carefully introduced into Mutra Marga and Basti Putaka is compressed uniformly. Then remove the netra by leaving some oil in the Putaka. In female, the patient is made to lie down on her back. Then she is made to fold her legs at knee, that is lithotomy position. Then the Uttara Basti yantra containing the prescribed dravya, Vata Sneha is taken and Basti Nitra is lubricated with Sneha is carefully introduced into Apatya Marga. Basti Putaka is compressed uniformly so that the dravya enters the yoni. It is practically that Vata returns immediately, whereas Sneha is retained for some time. Panchakarma. Rest for some time is advisable. As far diet intake is concerned, Acharya has suggested that after the Pratyagamana of Uttara Basti, at evening the patient should be given Mamsarasa, Payasa or Yusha. Uttara Basti Vyapad. There is no direct reference of Uttara Basti Vyapad, but the dosha mentioned for Basti, that is Basti Putaka dosha, Basti Netra dosha, Basti Pranidhana dosha and Basti Pidana dosha are applicable to Uttara Basti. Indication of Uttara Basti: in males, Shukra doshas, seminal disorders, example oligospermia, low sperm motility, Vandyatva, male infertility, Mutragata, urinary obstruction or retention, Ashmari, urinary calculi, prostatomegaly, prostatitis, Basti Shula pain in the urinary bladder region, Mutrakrucha, dysuria, Mutrameha, diabetes related urinary problems. In female, Vandyatva, in female infertility, Univapath, various gynecological disorders like Arthavakshaya, Kruchartava or Iruska, Garbhashaya Vikara, uterine disorders like fibroids, endometriosis, recurrent abortions, pelvic inflammatory diseases, inflammatory conditions of uterus and tubes, fallopian tube blockage as a supportive therapy, white discharge, postpartum uterine toning in some classical indications. Contraindications: Agni-mandya, Ajirna, Raktadushti, Atisara, Harsha, Jwara, Amlapitta, Garbhini, Rajodarshana Kale, Udarashula. Conclusion: the utility of the natural pathways to reach the target in Ayurveda is best practiced. Uttara Basti is such sophisticated scientific Panchakarma practice for all genital and urinary systems. Present fortified method for Uttara Basti ensures the result by quick and effective target reaching method.